Welcome back. We're going to get into the lower limbs now. So let's look at the pelvic girdle. Remember, the pectoral girdle was the scapula and the clavicle. Very, very lightweight, not very protective, but allowed for a lot of movement. The pelvic girdle is very different. So it's formed by two coxal bones, but each coxal bone is formed by three different bones that fuse together. So we have this ilium up here. We have this pubis right here, and then this ischium here. They fuse together, forming a coxal bone, and when you put both of these coxal bones together, you have your pelvic girdle. And so I'm going to go to the next slide, but I will point out a couple parts on here, just because I think it's fun. The ischium, this region right here, this bone right here, has a region called the Ischial Tuberosity. If you've ever had a child sit on your lap and they have a bony butt, and you say, God, your butt's bony? Well, it's that Ischial Tuberosity that's digging into your hip or into your thigh, not hip. So it's kind of crazy. We have a sciatic notch, a greater and a lesser sciatic notch. These notches are where the sciatic nerve actually runs around. And the sciatic nerve is one of those nerves that allows us to walk properly, and it also causes severe pain when it gets pinched. And that's what causes sciatica. And then this region here is the acetabellum, which is formed by all three bones together. And this is where the femur articulates. So the entire weight of our upper body rests on our pelvis. The pelvis itself protects multiple organs, so many of our reproductive organs, our bladder, as well as our large intestine. So it's very, not only is it sturdy, strong, but it also is protective. And here you can see the entire pelvic girdle, including the sacrum and coccyx, which are part of the axial skeleton. The pubic bones are attached by this pubic symphysis, which is fibrocartilage, a partially movable joint. When you look at female and male pelvises, bless you, Nick, that's my son, just if you're wondering who is sneezing, it's my son. If you look at female and male pelvises, the female pelvis has a wider false pelvis than the male's pelvis, as well as a wider true pelvis. We have a larger arch than the male pelvis. Our bones are much thinner than the male pelvic bones. All of these are important because we have to be able to push a baby through a birth canal through that pelvis. So let's look at the lower limb bones. Here's your femur. The femur has a head that articulates with the acetabellum. And then you have a greater and a lesser trochanter. These are often what you're feeling for in the hip to try and find a good place to give a shot. You give a lot of shots, injections between these 2 points on the femur. Down below you have the condyle as well as epicondyles. On this side you can see that linea aspera, which is this long line here, which is an attachment spot for muscles. And you can see again the lesser and the greater trochanter. You can see that neck is a little bit more pronounced on this side. And you can see those condyles again. So now let's look at the lower leg. So there are 2 bones in the crural region. We have the tibia, which is that large bone, and then we have the fibula. Fibula is actually not even a weight-bearing bone. It is more of a protective, and it functions more just to help the tibia do its job. The tibia then is the only weight-bearing bone of the lower limb, of the lower leg, okay? Up here we have the medial and lateral condyle, which articulate with the femur. We have this tibial tuberosity. Interesting tidbit of information. If an ambulance is going to, say, somebody's someplace, and a patient is passed out or anything, and they need to get into a blood vessel, and they can't get an IV started, they will actually punch through this tibial tuberosity to get into a blood vessel. So kind of an interesting tidbit of information. The fibula is just a pretty straight bone on the lateral aspect that helps to maintain the function of the femur, or not the femur, of the tibia. At the end of the fibula, we have this lateral malleolus, and at the end of the tibia, we have a medial malleolus. So these malleoli actually make up the ankle that we have. And then the last part of our lower body bones is the foot. And so we start with our tarsals. We have 7 different tarsal bones. We have this large bone here, the talus, which articulates with the tibia, the calcaneus, which is the heel bone, a navicular, and a cuboid bone. And then we have 3 cuneiform bones. So we have a medial, intermediate, and lateral cuneiform. All of these make up our tarsals, and they're all composed of short bones. So they're all those cube-shaped bones, which you can tell. Then we have these long bones here that make up the sole of the foot. These are called metatarsals. So in our hand we had metacarpals. Here we have metatarsals. There's 5 metatarsals. And then again we have 14 phalanges making up all of the finger joints of our toes, or finger bones of our toes. Finger bones of our toes. That doesn't make sense. Digits of our toes. That sounds much better. So, okay. Now, our feet are super important. So our lower limbs hold the entire weight of our body. And so our feet are actually what holds everything together. And so here you can see there are arches that are held in place by the way the bones form, or by the way the bones are put together, as well as by different muscles and ligaments. Okay, so we have a medial longitudinal arch, we have a lateral longitudinal arch, and then one that crosses over is the transverse arch. Hold on a second.